Hi guys, my name is Triya and I'm a junior doctor working in London. I have been a doctor for about 7 months now. I am an FY1, which means I'm in my first year of training after graduation. And these are some of the things that I have learnt from my experience so far. So I thought I'd start by talking about what it is really like for a junior doctor working in the emergency department or A&E. So the day-to-day life of a junior doctor really depends on what department you're working in, whether that's in A&E or a medical ward or a surgical ward or something completely different. So my first job as a junior doctor was in A&E, and I think it was a really good first place to start. One of the reasons is that you actually see so many patients yourself, so you really get a lot of clinical experience quite early on, and you can utilize everything that you learned from medical school while it's still fresh in your mind. Every day as an FY1, I would see somewhere between 5 to 15 patients in A&E, depending on how sick they were. Every day you'd be assigned to a different section of A&E, and this could be majors, minors or resus, which have differing levels of sick patients in. And the great thing is that you're very independent with the way you work. So for every patient that you're assigned to, you're the one who takes a history from them, examines them, and then comes up with a management plan all on your own. You're also really well supported because in the trust that I worked in, every time you saw a patient, they would have to be reviewed by a consultant or a registrar. So this meant that although you were making your own decisions, these were being supported by your senior colleagues, and you got loads of practice in presenting patients to your senior colleagues, a skill which is very important and one that is often tested in OSCEs and exams. Obviously, A&E is a very exciting environment and you get used to working in quite a chaotic place. There's always at least 4 police officers around, the emergency buzzer goes off once an hour at least, and there's always something crazy happening. So it's never boring at A&E, but most importantly, you see a lot of really sick patients and you get used to treating them and figuring out a management plan using basic first principles. So this is really important going forwards in your career because this means that dealing with sick patients doesn't scare you anymore. Okay, so my next job after A&E was in a medical ward, which was gastroenterology and also general medicine combined. So the day-to-day life of a medical ward is completely different to the one that you see in A&E. The pace is quite different and it is a lot slower. You have a lot more stable patients who are with you for a lot longer, where in A&E you see patients and then you either admit them or discharge them within 4 hours, ideally. You never follow up on patients and figure out what happened to them. This is the opposite in medicine. As a junior doctor on a medical ward, you are very much physically present in the ward all day. The way a typical day is structured is you have a board round or a multidisciplinary team meeting in the morning where you go through the list and you discuss all the patients. Then you go on a ward round where it's usually you with a computer and a senior colleague such as a consultant or a registrar going around and seeing each patient individually. This can take anywhere between an hour and a half to the entire morning. After that, you generally spend the afternoon on the ward as a junior doctor doing any jobs that have come up from the ward round. So this could be things like taking blood tests, writing discharge summaries, and looking after patients when they occasionally get sick. So a lot of people told me this when I was a medical student and I didn't really know if it was true, but having done a medical job now for almost 4 months, I completely agree when people say that this job is actually a lot of admin. So it's a lot of writing letters and prescribing medications, which can get a little bit repetitive. Certainly quite different to my experience in A&E where I was making a lot of clinical decisions myself, whereas in the ward it's very much senior led, so the consultant will make a lot of the decisions and then you enact them. If they're a good consultant, then they will involve you in the decision making or explain their thought processes to you so that you can learn as well. But if you don't apply your own brain and think about what they're doing, it can be very easy for it just to become an admin job where you don't actually use any of your medical skills. One thing that I have learned though, whilst being on a medical ward, is the importance of continuity of care. You definitely see a very different side of medicine in comparison to the acute and emergency side that you see in A&E. In A&E you deal with life-threatening issues and then anything else that is happening with the patient you don't think about and you let someone else deal with it. Well, in the medical ward you are that someone else who is dealing with the patient as a whole and thinking about the patient a lot more. So you do actually see a lot of very exciting things, but you have to find them yourself and make the most of the time that you're there, because if you're not careful it can easily feel like quite a boring job. One thing I want to talk about, which is a very important topic in medicine, is stress and burnout. So, being a junior doctor is really like any other job. You'll have good days and you'll have bad days. I think the thing that makes being a doctor quite difficult, or working in healthcare in general, is that your bad days can be particularly bad, with people dying, things going wrong on a very catastrophic scale. You really do have to deal with a lot of death, especially on a medical ward when your patient population is quite old. It is very hard. Until I had started this job in a general medical ward, I had never seen someone actually die in front of my eyes. People throw around the word resilience a lot, and that's the ability to cope with stressful and tough situations. I do think it is a skill that some people are better at than others, and it's one that you definitely have to develop whilst you're working as a doctor. But personally, I think the resilience is a bit like a rubber band. If you stretch it too far, or you stretch yourself too far, it'll end up snapping. So I think it's really important to look after yourself. The way that I cope with difficult things is that I remind myself that medicine is just a job, like any other job, and there's much more to life. So I think it's really important that you don't leave behind other aspects of your life, such as hanging out with friends, family, hobbies, and things like that. I think definitely talking about it with your colleagues can help, because ultimately it is a shared experience between people who work in a healthcare system, or if that's too difficult, then writing about it is also helpful. Unfortunately, in order to progress in medicine, you do need to jump through a lot of hoops, and for example, those are things like doing postgraduate exams, doing quality improvement projects and audits, getting research papers and things like that. So it's not enough, unfortunately, just to do your 9 to 5 or whatever hours you have. That being said, you have your whole life to progress through medicine, so I wouldn't rush to finish it all in the first year or the first couple of years. You do have time. Increasingly now, more and more junior doctors are taking time out of training to do locum work or to travel and work in different countries. Medicine is not a conveyor belt that you get on at medical school and then you don't get off until you become a consultant. You definitely can stop, take breaks, make changes, do medicine in the way that works for you. So just some quick tips that I've learned from being a doctor for 7 months now. It's really important to make sure that you stay hydrated. Carry a water bottle with you on a ward round because they can go on for hours. Make sure that you take all your annual leave and your allocated study days. Even if you're just lying at home and doing 1 or 2 things, it's definitely really important to make sure you take all your leave. And if you ever have to stay late, which can unfortunately happen quite often in medicine, especially if you're on a busy ward, make sure that you're either paid as reimbursement or you take time off in lieu. This is really important. Those are a couple of my tips. I hope that was useful. If you have any questions, let me know, and I'll see you in the next video. Thanks, bye.